Okay, so here's my plan of care for Mr. Webster based upon the assessment and his history and the systems review that was performed this day. So first and foremost, I'd like to address Mr. Webster as a whole and address the reason that brought him into, or that he was admitted into the emergency department, and that is because he had uncontrolled levels of, or his blood glucose levels were not being controlled. So, as Dylan mentioned last week, a big part of our responsibility as physical therapy is to educate our patients continuously. So, part of my plan would be to educate this patient on the importance of diet. A part of that would be to also refer this patient to see a nutritionist. That way we can ensure that the patient receives proper diet going forward. And I'd also work with nursing to make sure that the patient is receiving insulin and that the patient is able to administer their insulin on their own going forward. I'd also educate the patient on the effects exercise has on his blood glucose, and I would work once again with nursing to figure out when the patient eats and when they receive insulin to make sure that their blood glucose is within range that they need it to be in order for this patient to engage in physical activity. So the plan of care might say something like continue to monitor blood glucose levels with nursing staff to ensure patients' participation in physical therapy. Another part of our plan of care would be to refer this patient to see the medical doctor. A part of the assessment found that there were some signs and symptoms of a possible DVT on the patient's left calf, and we'd want to just rule this out or get proper treatment for this in order for the patient to once again continue with physical therapy. I also want to refer this patient to a psychologist. I liked what Catherine mentioned last week, that we would like this patient to receive treatment for their depression because this also played a role in how this patient got to where he is now. So we want to refer the patient to a psychologist or to the medical doctor to start treatment for that. A part of our plan of care would be wound management. So physical therapy can do wound examinations, and based upon that, we can set some goals that we'd like to see in the next couple weeks with this patient. This might include a decrease in the wound size. It could be improvement with drainage. We can teach the patient how to change their dressings. We can work with nursing to ensure that the proper dressing is being used. We can ensure that the dressing is being changed at the appropriate times. And again, just educate the patient on wound management, reducing the risk for infection and things of that nature. We also want to include mobility in the plan of care. So it says that the patient requires minimal assistance with bed mobility and transfers. Our plan would therefore be to have this patient only require supervision and verbal cues when performing bed mobility and transfers, and we can set a goal for 2 weeks for the patient to achieve that. We would also address the high risk for falls in our plan of care, whether it be done during this assessment or the next one. We'd want to do a Berg balance test, and based upon those results, we can once again set a goal for where we'd like to see this patient in the next 2 to 4 weeks. Aside from that, we want to teach the patient how to ambulate with an assistive device to offload that left foot, specifically the great toe with the wound on it. This way we can allow the wound to heal properly and not interrupt the healing process. So again, this would include education from the physical therapist to the patient, and proper gait training with a walker on how to offload that foot. So something else I wanted to mention that Dylan brought up last week was checking or performing an ABI test to ensure that this patient doesn't have any arterial insufficiency or diseases, whether that be done once again during this assessment or the next assessment. We'd want to do that as well. So just as a overview in our plan of care, we want to ensure that we monitor this patient's blood glucose levels. Most importantly, we want to refer them to a nutritionist to monitor their diet and ensure they're receiving a proper diet, make sure that they're receiving their insulin, and work with nursing to figure out a good time for us to come in and work with this patient. We want to continue to do wound examinations to see improvements with the wound. We want to use an assistive device to offload that foot to allow this wound to continue to heal. We want to increase the patient's bed mobility and ability to perform transfers independently. And we also want to address their high risk for falls by doing balance exercises.